Hello, my name is Dr. Hunt, and today I would like to talk to you about obesity and pet nutrition in our dogs and cats. Canine and feline obesity is the #1 most common form of malnutrition in the United States today. It seems to be following the same epidemic that we're seeing in people, and that seems to be a natural occurrence. Obesity in dogs and cats follows the same side effects that we see in people. In dogs, one of the biggest problems that we see is an exacerbation or worsening of arthritis, particularly when you have elbow dysplasia, hip dysplasia, knee injuries, or back injuries. All of those are fairly common in our dog patients. In cats, we often see a worsening or the development of diabetes, similar with people patients. And the first step to approach this problem in our pets is to first be able to identify what is the right body condition for a dog and or a cat. And the problem that we come across in this is what I refer to as landscape amnesia. The problem that we have is that when we have 50% of our dogs or cats being overweight, we see them with this body condition score, which is a little bit hefty. So we see 4 or 5 dogs or cats that look like this, and then we see 1 or 2 cats that look like this. And pretty soon, because we're seeing more and more dogs and cats that are overweight, we begin to believe that that is the appropriate body condition for our dogs and cats. But the truth is that such is not the case. We've forgotten what the ideal body condition is for our dogs and cats. Now, to help us with this process, we've developed a body condition scoring chart. Our scoring chart starts at 1 and ends at 5. 1 is an emaciated patient, while 5 is the obese patient. 3 is ideal. I think it would help to understand the body condition scoring if we can imagine the skeletal system and the body being placed upon the skeletal system. An emaciated patient would be a patient in which the skeletal system is very obvious. You can see their ribs, you can see the bony prominences of the spine, as well as the hips. The waist is very prominent, both from the side as well as from the top. That's an emaciated patient, or a body condition score of 1. An underweight patient, body condition score of 2. The ribs are still visual, though less so. The spine likewise, the hip as well. The waist is very prominent. An ideal body condition score can be illustrated with this dog here. The ideal body condition score of a dog or cat is one in which you cannot see their ribs, but you can feel them with light pressure with your fingers along their side. Likewise, you can feel their spine, but you cannot see the spine. Same with the hips. The waist is still visual. You can see an abdominal tuck from the side as well as from the top. And that is the ideal body condition score for a dog or a cat. The dogs and cats that we're commonly seeing today are overweight. And what you see in an overweight dog or cat, you cannot see their ribs. You can feel a layer of fat as you're palpating or feeling along their ribs. And their waist seems to have disappeared. It's more of a tubular structure, straight from the chest back to their legs, and from the side straight from the chest back to their hips. An obese patient is a dog or cat in which you cannot feel their ribs with heavy pressure on the palpation of their rib cage. And their abdominal tuck is in reverse, where it goes down from the side and out from the top. You'll also notice that there are fat deposits on their front legs, on their back legs, and very commonly at the base of the tail. With this tool, we can appropriately condition or body score our dogs or cats to identify when they might be overweight. I hope this helps in our effort to fight canine and feline obesity. Thank you.